fast as I'm going to be.
Okay. You're good.
Hi, Ms. Hernandez. My name is Jasmyn. I'm going to be your student nurse today. We're just going to be doing a postpartum assessment, so we're going to go ahead and get started. First, can you verify your name and date of birth for me? Good. I'm just going to double check with your band real quick. Thank you. I'm going to start off with doing some vital signs, okay? So I'm going to go ahead and I'm going to put this oximeter on your finger so that we can check your O2 stats. And at the same time, I'm going to go ahead and I'm going to take your temperature, okay? Perfect. So the normal range is 98.6, and your oxygen looks good. You're at a good 96%. I'm going to take your blood pressure. Looks good. You're at a strong 120/80. All right, now I'm going to take your pulse real quick. While I'm taking her pulse, I would also check her respirations as well after I hit the 30 mark, just so that way she doesn't know that I'm actually taking it, and change her breathing style. So, okay, that looks good. Can you tell me if you've been in any pain? All right, and then could you rate that for me on a scale of 0 to 10, 0 being no pain and 10 being the worst pain imaginable? Okay, about a 3. We're going to get that taken care of for you. All right, and then while I'm here, I'm going to begin by assessing your breath sounds. So Ms. Hernandez, I'm just going to remove your gown a little bit though, but I'm going to keep you best covered as I can so I can listen to your breath sounds. Can you take a deep breath in for me and let out? Good. And again. Good. Let me know if I'm going too fast for you, okay? All right, we're going to sit up really quick so that way I can listen to the breath sounds on your back. Deep breath for me. And again. Great. Go ahead and relax. Okay, now I'm going to start the bulk of your postpartum assessment. Can you tell me if you've had any pain in your breasts recently? No pain? Great. I'm also checking to see the firmness, okay? They're doing pretty good. No redness as well. Your nipples are intact. Okay, well while we're here, I'm going to go ahead and I'm going to take a look at your uterus. I'm going to use a two-handed approach so that way your uterus doesn't flip on me or move for me. We're going to check the firmness of your uterus. So I'm going to put one hand on the base here, and then I'm going to use my top hand to kind of feel for the top of your uterus. So it's firm and it's midline, which is good. And then I'm going to check where the position of your uterus is in relation to your umbilicus. So it's about 2 finger breadths below. If it was any higher, then I would be kind of worried about if you're having like a hemorrhage or if your bladder's full. You should be going to the bathroom about every 2 hours since your body had all that excess fluid built up in it to prepare you for your delivery. And then if she would have had a cesarean delivery, I'd also check her incision and see if it's intact, if there's any redness and whatsoever there. That's great. Alright, so I'm going to go ahead and I'm going to listen to your bowel sounds while we're here. Can you tell me the last time that you've had a bowel movement, Miss Hernandez? It's okay if it hasn't been recently. It might take you a few days. When you're pregnant, your bowels kind of slow down a little bit. All that smooth muscle relaxes in there. Have you been passing any gas though? Well, that's good. If you weren't, we definitely need to get you up and moving to help pass some gas. So your bowel sounds look good. Can you tell me the last time it was since you've peed or urinated? Okay, we want to keep that every 2 hours. Has it been painful at all? No. Okay, that's good. Alright, so your bowel sounds sound good. Next I'm going to go ahead and we're going to check your pad. So before I do that, I'm going to put some gloves on. The blood on your pad is called Loki. Should be a bright or dark red color. Do you know when the last time was that you changed your pad? About 2 hours ago? Well, when we look at it, we put it in relation to about an hour. So I'm going to cut that blood flow in about half, and so it looks like you've had pretty light bleeding. It's kind of scant, so that's really good. And it's red just like it's supposed to be as well. Okay. And then I don't see any clots, and it just smells like a normal menstrual period, so that's really good, okay? Alright, now we're going to roll you onto your side so I can check for your episiotomy, okay? Alright, so our perineum's intact. There's no redness, no edema, no bruising. She doesn't have any discharge besides the Loki, and her incision is approximated. So that's really good, Miss Hernandez. Very good. Alright, I'm going to lower you back onto your side. Didn't see any hemorrhoids or any signs of STDs while I was there either, so you're doing really great. Alright. Now while we're here, I'm going to check for your Homans and Clonus sign. I'm going to cover you up as best as I can. Alright, so I'm going to support your leg with my hand right here. And I'm going to push up. If her leg or if your foot would have popped back at me, it would have been a positive Clonus sign, meaning that your reflexes are a little hyperactive. Okay, did you have any, or was there any pain while I did that? Okay, that means it's a negative Homan sign for the blood clots, which is really good. Alright, and then during this whole assessment, I'd be asking her questions kind of about how her baby's doing, assessing her emotional state at the time. And if her fundus would have been soft when I checked it, I would also do a fundal massage to kind of help with the contract the uterus and keep it so it involutions. Okay. Also, if she would have had a episiotomy, definitely make sure to check your IV site. No redness or swelling, so that's really great. Checked her dressing already, so that was good. And if she would have had a catheter, just checking the site and seeing how much she's outputting as well. I think that's my postpartum assessment.